Learning outcomes. After studying this module, you shall be able to learn the concept and need for the neuropsychological rehabilitation, understand the need for pre and post rehabilitation evaluation, learn about patients who need and the team of experts who provide rehabilitation services. Learn about the need and contents of physical, speech, occupational and recreational therapies. Understand the importance of counseling services in the rehabilitation program. Introduction. Life is precious, but at the same time it is full of uncertainties. We may encounter such accidents which may leave us with traumatic brain injury, a stroke or some other damage to the brain and leave us in a state that may require neuropsychological rehabilitation. As a result of such adversities, a patient may suffer from a number of abnormalities in cognition and affective and motor behaviors that may take his day-to-day life very difficult to handle. With the advances in medical science, the first line of treatment, that is stabilizing the medical condition of the patient, has become easy. But that is not enough to help the patient to become as independent as possible in managing his day-to-day life requirements. Some kind of rehabilitative efforts are required. Neuropsychological rehabilitation is the process of restraining and re-educating the people with disabling injuries to improve level of daily functioning. The rehabilitation centers requires the family members of the patients also to take active interest and participate in the process of rehabilitation. It is more than just hospital treatment and care. The aim of rehabilitation is to facilitate the process of normal living for the patient. They indulge in setting goals and formulating the treatment plans and policies. Psychological principles are applied in treatment processes. Rehabilitation programs include patients of a wide range such as brain injury, traumatic brain injury, as well as patients suffering from hypoxic anoxic conditions. The help is also extended to people suffering from non-neurological conditions such as burn, chronic pain, blindness, amputation, etc. The hospitals dealing with rehabilitation programs are super specialty hospitals dealing with a long-term treatment program. The tenure of the stay of the patients has shortened with the advancement of treatment facilities. Moreover, the treatment is not restricted only to inpatients care but to outpatients care as well. The theme of rehabilitation is to apply knowledge of brain behavior relationships and neuropsychological evaluation to the process of recovery and community integration. The challenge before the rehabilitation team is to translate the patient's current level of functioning to the most optimum level of facilitate his daily activities of life. Acute care hospital to rehabilitation program. Acute care hospital provide the primary treatment of any disorder, injury or cerebral trauma to the patients, while most of the post-recovery adjustment work is to be carried out in the rehabilitation centers. The neuropsychologists dealing with the rehabilitation program work in both rehabilitation hospitals as well as acute care hospitals. Doctors dealing with brain injury get a first-hand view of patients recovering from coma, brain surgery, etc. After the patients regain their senses, they undergo evaluations of alertness, sensory, motor and cognitive skills over the course of the first few days and course of recovery before they are transferred to a long-term rehabilitation hospital. Their change of cognitive functioning is assessed, which act as a baseline for further treatment. Admission to the rehabilitation program is determined by the neuropsychologist, who assess whether the patients have the scope for recovery and success in the rehabilitation program. Thus, the neuropsychological assessment of the patients at various stages is of crucial importance in the whole process. The very act of being admitted to a rehabilitation center suggests that they are not dependent on any medical life-threatening crisis. Rehabilitation hospitals provide the basis for returning at a home setting and being able later to adjust to the family life. The phase of returning from hospital to home setting is called transition phase. Even before this transition phase, there is another transition phase from the acute care hospital to the rehabilitation one. The rehabilitation hospital acts as a facilitator during these transition stages. The main aim of the program is not to keep the patient in the rehabilitation center forever, but rather to make the patient independent and recover from the sick role into which he must have found himself in the acute care hospital. The team of experts in the rehabilitation program. The process of treatment is assigned to a rehabilitation team where patients are looked after on the basis of their needs and requirement. The team of experts to look after their needs comprises of psychiatrists, psychologists, neuropsychologists, social workers, nursing care personnel, speech therapist, occupational therapist, recreational therapist and physical therapist, as well as physiotherapist specialist. It also includes medical specialists like pediatricians, orthopedicians, urologists, cardiologists and ophthalmologists, audiologists and nutritionists. Counselors specializing in various areas are also a part of the team. The patients are divided into various units according to their predominant need. They may be going from one specialist to another on a daily basis. They are under continuous assessment about the changes in their cognitive functioning. There is a difference in the environment of a hospital and rehabilitation center. So, the patients usually take some time in adjusting to the rehabilitation center. The training undergo in a rehabilitation center aims to help the patients become acquainted with the home environment in a new scenario, that is, after the deficits caused due to the brain surgery of the mental disorder. They are counseled about their loss of the cognitive functioning and how brain damage can affect behavior. So, the rehabilitation team has to act as a coordinator between the community and home. Rehabilitation program is fruitful when it is multifaceted. So, the training program is very comprehensive, comprising of retraining for executive functioning, attention, planning, decision making, emotional management, motor coordination and so on. Neurological basis of recovery and rehabilitation. It has been observed that reorganization of brain occurs after injury. The brain processes plasticity of function. Plasticity refers to brain's capacity to recognize itself. Recovery from emphasis, for example, is supposed to be caused by the adaptability of Golgi type 2 neurons. Axonal regrowth, particularly in the young age, has been observed where the neurons are only partially damaged. The neurons collateral sprout widely and new synaptic connections are made. Innervation supersensitivity also occur, resulting in greater excitatory or inhibitory potentials depending on the types of neurons. Dice's theory proposed by Monakov, which described that the loss of functions caused by lesions in area remote from the lesions may be neuronically connected to it. Neuron function is simply inhibited or depressed rather than lost. It may be depressed due to or intracranial pressure and may be restored when the depressing factors are corrected. It is different from the restitution where the function is permanently lost due to damage of the brain tissue. This theory represents an imbalance between excitatory and inhibitory mechanism. Neuropsychological rehabilitation program therapies. Several rehabilitation programs or therapeutic devices have been devised. Computer programs are also used for rehabilitation purpose, such as attention rehabilitation program, where they are presented with various stimuli and they have to respond to these stimuli as quickly as possible. Various programs are designed and customized according to the various needs of the patients. These programs help develop various skills and abilities required to lead a normal life. Mental activities may help develop cognitive skills, executive functioning and planning and decision making. Many hospitals in India also have come up with rehabilitation programs. There are two primary approaches to rehabilitations, particularly in the context of brain damaged patients. They are restitution and substitution of functions. The former stresses retraining of an impaired skill, while the latter focus on searching for adaptation of the person with his environment by developing substitute strategies. Substitution involves the use of other behavioral devices to work around the problems or serve as external prosthetic device to develop and help take the place of the function that is lost. The restitution approach is called cognitive remediation, in which the skill like memory or attention are rebuilt. It is supposed that with practice the brain may be able to rebuild axonal connections. Basically, it means developing new connections around a theme rather than restoring previously existing axonal connections. It helps development of some compensatory strategies. Theoretical concept of learning and relearning are utilized to develop practical skills. Such skills can only be developed in their right sequence, from the simplest to the most complex ones. They may range from basic mental activities of focused attention to the most global functions like driving a car or managing the household. The context-driven approaches emphasize treatments that involve training the individual's right in his home or his workplace. This training is specifically geared up to the task that he will have to perform after leaving the rehabilitation center. Use of job coaches, driving trainers or on-the-job supporters are required to further facilitate the task. Such programs are also known as ecological valid approaches. Generally, a combination of cognitive mediation and context-driven approaches is used as an eclectic method to conduct the rehabilitation programs. A neuropsychological rehabilitation program includes the following. First, physical therapy. This therapy basically emphasizes motor control and motor coordination. Physical therapists assess the level of physical impairment and tries to design program based on patient's need and requirement. It looks after many motor movement difficulties such as walking, sitting, rolling and so on. They are taught to strengthen their muscles, balance and walk. On the basis of their need assessment, they are provided with walkers, crutches, braces and etc. Physical therapists emphasize on the relearning and training of the activities such as muscle control, balanced walking, use of walkers, canes, braces, splits, etc. and development of sequences in walking and other motor activities. Activities such as wheelchair management and wheelchair populations are taught. Second, occupational therapy. Occupational therapy is related to training in various activities of daily lives such as bathing, cleaning, grooming, dressing, feeding, home management, money management, meal preparation and other household chores. The performance components like moving, bending, lifting hands, speaking loudly, climbing etc. along with the sensory perceptual components essential for specific movement are determined and evaluated before starting any program on occupational therapy. The purpose of occupational therapy is to help the patient so that they may be enabled to lead a normal life after they move out from the rehabilitation center. The stroke patients are specifically taught to perform various directed actions and to be able to do other meaningful simple activities. Stroke patients have problem in goal directed behavior as they suffer from apraxia. Patients are given special trainings on decisions making, problem solving, thinking and remembering. In physical therapy, the focus is on the lower body, below the waist. In occupational therapy, the focus is on the body above the waist. Sensory perceptual skills have priority over simple motor skills. An example could be the program to develop the depth perception of the patients by making them pick up things at various distances. Occupational therapy assistants under the supervision of licensed occupational therapists help patients of all ages with physical, emotional, social and developmental disabilities. Engages in activities of daily living, educational, vocational and leisure skills. Graduates are eligible to work in hospitals, rehabilitation centers, special schools, mental health facilities, private practices and nursing homes. Third, speech therapy. The therapists provide therapy to a range of patients who have difficulties in speech including speech production, expressive language, hearing and understanding speech, reading, writing and social use of language. Patients may suffer from various difficulties related to speech. This therapy focuses on the simplest, that is auditory acuity, to the most complex, that is complete communication with gestures and appropriate emotionality. Use of prosthetics is also made to assist communication through artificial means. With damage to the frontal cortex controlling speech muscles, special difficulties related to speech production may be encountered. They are known as dystherias. Assistance is also designed to provide cognitive linguistic integration which is characterized by aphasia, alexia and agraphia. Specialized computer programs are also available for the purpose. Rehabilitation services, physical therapy, occupational therapy, speech therapy, etc. at Beth Israel Medical Center, a teaching hospital of Harvard Medical School, provides comprehensive rehabilitative care for the patients with a wider range of impairments, functional limitation and disability. Recognized as leader in their respective fields, our clinicians utilizes the most advanced technology in rehabilitative care. The service is comprised of 3 rehabilitation disciplines: physical therapy, occupational therapy and speech language pathology, voice and swallowing. Fourth is recreational therapy. Recreation is a part of therapy. It is not just for fun, but it has other purposes as well. It helps in transfer of learning to real life situations. This way, the patients develop new skills and learn to socialize with others. Whatever has been learned in occupational, speech and other therapy session is carried out particularly in recreation setting and leisure time activities. Community outings are a part of therapeutic recreations. They further develop mobility skills by climbing on ramps, stairs, elevators, handling doorknobs, avoiding obstacles, etc. Recreational therapy also encourages the development of some cognitive skills like money counting, problem solving, communicating effectively with others, use of right kind of language skills and the skills of non-verbal communication. By making drawing and drafts, they can also relearn the skills of motor coordination and aesthetic appreciation. Now, evaluation and goal of discharge planning. The rehabilitation team decides on the date of discharge, their goal and the program from the very first day itself. This is a controversial issue as many believe that discharge cannot be planned on the very first day without evaluating the condition of the patients thoroughly. However, a tentative estimate is at least made and programs and treatments are carried out accordingly. It is seen that in the most of the cases the patients want to return back to their home environment. The rehabilitation team needs to keep that under consideration. The program should be designed in such a way that it facilitates or helps the patients to adjust to his home environment after getting discharged from the rehabilitation center. It is important to note that in the entire process of rehabilitation, the family and the caregivers should be equally active along with the professionals. The process is multidisciplinary in nature, focusing on speech therapy, occupational therapy, physical therapy, etc. Each therapy specializes in helping functioning of different areas of brain. Occupational therapy helps to apply motor activities learned in physical therapy. Recreational therapy helps to cope with leisure time activities and also to apply skills in real life settings. It focuses on all-round development of patients. Psychologists are appointed for any mood-related problems. Counseling is done whenever it is required. Treatment process is parallel in nature. Two main aims of rehabilitation program are to evaluate the patient and see the level of improvement or deterioration and accordingly plan further action. Second, the aim is to train and educate the family members. They are made to understand that the treatment would continue even after the discharge in the home setting. Now, evaluation of success of rehabilitation program. A successful rehabilitation program is dependent on proper planning and evaluation. A successful program is determined on the basis of recovery from treatment and to judge the probability of recovery. Different aspects need to be taken into consideration while planning the treatment program, such as the patient's location, extent of damage, duration of time since recovery, pre-morbid intellectual level, pre-morbid personality features, age, medical condition, emotional health, available support system, chances of recovery, the area of impairment, other areas of strength which might compensate for his impairment, and specific help required in the process of recovery. Chances of his recovery are analyzed collectively and further research is done for determining the treatment process. Recovery is dependent on a number of factors such as level of impairment, his motivation to improve, and his present state of functioning. A lot is also affected by the care and the support of family members. So, the prediction and evaluation of recovery is not an easy process. Now, psychotherapy in rehabilitation. Psychotherapy is very essential in rehabilitation program. It is seen that rehabilitation program aims not only in dealing with cognition but also with the affective aspect of behavior such as emotions, feelings, personality and awareness. In most of the brain injured cases, the person suffers from altered self-awareness which is the result of his injury. In that case, neuropsychologists aim to help the patients to deal with personality and aspects related to his self-concept and identity. This kind of therapy can help the patient deal with frustration and anxieties. But it is often found that patients often complain that they no longer feel normal after the accident. They have to go about a lot of adjustments, basically readjustments after the accident. There is a lot of change in the person's social life, his social relations are at stake, because the patient is not able to interact or deal with his personal relations the way he used to do before the injury. At times, even the family members do not understand the state of the patient. They complain that the patient has undergone a complete personality change. Evidence of poor interactional relationship is seen in behavioral rating of close relatives and in direct observational studies of such patients. If brain damage affects the frontal lobe, it impairs executive functioning such as decision making, planning and problem solving, abstract thinking, judgment, and so on. Impairment also includes inability to act empathetically or to see others' problem or viewpoints. All these aspects require coordination and integration between feelings and thoughts. This lack of perspective thinking might be present in the patient with varying degree of intensity depending on the severity of impairment such as mild, moderate and severe. Psychotherapy is of much help in dealing with these problems and also aid in developing skills to cope with different problems. Thus, the concept of neuropsychological rehabilitation is very important and needs a lot of attention. Not many hospitals have proper settings for conducting an appropriate rehabilitation program. Many institutions have come up with various programs. In India, National Institute of Mental Health and Neuroscience has taken initiative in this field. Now we come to summary. The aim of rehabilitation is to retrain and re-educate people with disabling injury to improve level of their day-to-day functioning. Assessment of neurocognitive deficiency treatment plans and prognosis is made before admitting a patient into rehabilitation program. Physical, occupational, speech and recreational therapies along with psychotherapy are provided to the patient. Cognitive mediation and ecological valid approaches are used to restrain the patients. Follow-up programs are conducted to evaluate the success of rehabilitation program.